Good afternoon. My name is Francesca Rubulotta. I'm doing this question and answer section to answer some of the tweets and Facebooks and emails I received since I started my campaign for President-elect of European Society of Intensive Care Medicine. I do apologize for the delay, but I think there were some difficulties related to the possibility you will have to send me questions. Unfortunately, the link that I had before was not working well, so you will receive in few minutes a new email that can allow you to send me questions. I think this is very important. As I said, I have already presented my presidential program, and the pillars of my programs are three, and in particular, equal representation, education, and innovation. You might have seen video that have explained those concepts, and I saw you've been very reactive to those. I now would like to talk a little bit more in depth about the question that you have asked to me in these different topics. Usually you can look to your email and use the new link to add questions. Those will be forwarded to me, and over the next hour I will do my best to try and to answer, or at least to note what your comment and challenge will be. I will start with questions that I've already received, just to give you time enough to prepare, send, and get forward those questions to me. So I will divide those based on the three main pillars, and I would like to ask with representation. So I would like to thank, first of all, Ina for writing me and asking how to change the perception of young physicians that European Society of Intensive Care Medicine is only for already established ones. And how can we help people to feel that this is for all members? Well, I think that's the idea of engaging and communication as always two ways. So one way is between the leadership and the members. The other way is between members and leadership. We have several ways nowadays to engage. They're challenging, as you can see today, but those are available. You might have already received a survey for members. When I was working with the Division of Professional Development, and when I was the chairman of Cobatrice, we decided together with the new chair, Pascal Gruber, that was very important to ask members what do they need in education. So you might have already received, or you will be receiving in the next coming days, a member survey that is looking to the educational needs. We have a pool of activities. We have a very advanced e-learning platform. And because time and money and effort needs to be engaged in develop different topics, it's important to know what is that you need. Of course, we can assume that you would like to talk about monitoring, sedation, but actually we cannot know the priorities, or we cannot set the priorities unless we ask you to tell us. So I think this is very important. Is by asking members what they need, we can prioritize and deliver efficient work. I received another very interesting question regarding representation from Jordi Rello, who I'd like to thank. He's asking me, it would be important to guarantee the free circulation of intensive care specialists within the European Union. what action will be done to implement it? Well, I think this is a great question, and I really care about this topic because, you know, I've been working in different countries. I have difficulties all through my career to find the way to recognize my studies and certifications. I think this is something that I've been working very closely with several colleagues, and I'm so sorry that today in the debate, Maurizio could not be part because we share so many interests in this area. So it would have been interesting also to see his point of view. However, over the last 8 years, I've been working for the Union of Medical Specialists. What is that? The Union of Medical Specialists is an advisory board of the European Union. So it's not a political or a legislative body, but it's an advisory body of experts from all over Europe and from every single specialty. As experts, we can advise how long training needs to last. We can advise what are the criteria for a specialist to safely move, work across countries. I've been working for 8 years looking at the quality of exams, looking at the quality of events, and now to give credit to those events. And now is a great time for me to campaign as president of European Society of Intensive Care Medicine, because the new president of the European Society of Anesthesia, Professor Kai Zakharowski, is the chair of the Union of Medical Specialists. So I had the opportunity over the years to share projects, to share ideas. And if I will be the president, I can use all the time and all the experience I develop in the Union of Medical Specialty to address the issue of harmonization and free movement of specialists. It's not an easy answer, and unfortunately, countries like my own country have several differences and cannot be compared. So I think one solution that fits all countries not possible will be an easy way, but will not be the best way to answer this question. The work needs to be done step by step, country by country. I'm trying to see whether you have received the link. Please look it up your email, because I think it's very important that you send me questions live. I will continue it in the meantime among the questions that I've already received. And it's a question from Italy coming from Laura saying, you have a sensitive and you have a particular interest working in Africa. What the European Society of Intensive Care Medicine could do to be more involved in education for those doctors? Thank you very much for these questions. Yes, I'm privileged to go and teach in South Africa every 2 years. But if I may, I would like to answer to this question in a more complete way, because I think Africa is one among several emerging countries, and a solution actually can be shared among doctors training in all of them. I also have received comments related to this same topic by Dr. Ghosh from India and Kumar, and they are telling me that effectively having a guru visiting and teaching at the bedside in several countries is really important. Nevertheless, that is difficult. I think it's important to allow face-to-face training, but if the European Society needs to address a broader group, a larger group of people, then maybe thinking about traveling and one-to-one, face-to-face at all time is unrealistic. What I think is important to say is that any educational project needs to be started, but it also needs to be sustainable and maintained. Because what I saw over the years, being the chair of the division, is that people are really enthusiastic when they get into a new concept. But to maintain, to keep educating, to find the time and the energy to continue over the years is really challenging. So I'm worried about that. And I think you need to combine face-to-face, traveling, teaching at the bedside, even in emerging country, with some blended learning. So what about if we can provide fundamental concepts through webinars or through the academia? So I don't think that the major pillars of learning, the basics of intensive care, need to be addressed at the bedside. People can read about that, but can also use video, and maybe by the time the expert comes at the bedside, the time can be used in a more fruitful way and efficient way, and maybe doesn't need to be repeated year after year, but can be a little bit more distant than people as used to be. What about question related to education then? Well, I received a tweets recently saying and asking me, what is that I learned through Cobatrice? Will we achieve harmonization of training? What is the next step? So I think all of you know about Cobatrice. For those that are not aware, Cobatrice means competence-based training in intensive care medicine in Europe and in other regions. I got involved into this project when I was a student. I was 27 and I was asked to represent the junior trainee point of view into the nominal group of experts that were defining the curriculum of an intensivist. I think Cobatrice is an incredible project because not all of you know that the project started not by asking doctors what the curriculum should be, but by sending a survey to families. So essentially, we ask patients and their family, what do you expect? What do you think an intensivist should be? And based on their answer, this shaped the curriculum. This was a completely innovative approach if you think that the project was funded in 2003. And I think Cobatrice changed a lot. When we started, we had no idea of what was going on in Europe, and we wanted to give a roadmap on what we felt was important. Nowadays, the situation is completely different because every country, especially in Europe, has developed their own curriculum and experience. So it's not our role anymore to tell people what is important to do or what we think is right, but probably we should do a step back and ask, what is that you do? And are you pleased? How can we support you? And is this training really making better doctor? How can you tell us that actually patient care is improved compared to 10 years ago? How can we set up outcome and how can we do research on this topic? I start receiving some questions from you, and once again, please take the opportunity to look to your email and link to ask me live questions. I would like to thank you for the opportunity to air directly the opinion that you have on these important topics. And I would like to ask also, I would like to ask John from England, who has asked me the following question. I am observing people that go to Congress, but unfortunately, the majority of cases, they do not implement new things, but they work as they did before the Congress. is that anything you will do to change that? That's a very difficult question, I suspect. And then obviously depends of what type of congress and conference. I think we largely know that teaching and telling people in a large audience doesn't really help, because it's not enough interactive, because the room is too big. So sometimes listening to a lecture can be interesting, but it's very far away from helping people to implement good practice at the bedside. The other problem is that adult learning is very different from children. Andragogy teaches us that for adults to learn and to change their practice, they need to be involved and they need to drive their learning. So sitting in a room expecting to hear something useful does not always correspond with changing a practice or finding exactly the reason why they were attending the Congress in the first place. I think that smaller groups, smaller conference, workshops and webinars and learning through the years can support that. So even presenting large studies in big conferences can be enhanced by work done at the side and using other methods that match better adult learning during the year after the Congress. So you need to give new devices and innovative learning methods for that. I think I received another question from Davitavili, sorry for my pronunciation. And the question is quite interesting because he's asking me, what about Georgia and Eastern European countries? How close can we come to European Society of Intensive Care Medicine, and how can we be involved more in European Society of Intensive Care Medicine activities? So I should ask David, why is that the number of members of the European Society of Intensive Care Medicine in Eastern Europe is so low? Well, I've tried to ask people, and I think there could be different problems. One, obviously, is cost, because I realized that GDP and salary of especially junior doctor in Eastern European countries, and where I come from, because I come from the south of Italy, so I can see the problem related to becoming a member, to travel to major European cities as a challenge. The other thing I'm concerned about is language. And, you know, English is not my mother language. And I must confess, I struggled, and several of my colleagues still struggle with language barriers. European society obviously needs to have a front and common language, which is English. But I feel that not enough has been invested in translating fundamental concepts, guidelines, documents. Cobotris, for instance, has been now translated in 10 languages, and I think this was crucial to implement the curriculum in several countries. If I become president, I think I don't have a ready-made solution, but as I've done as the chair of Cobotris, I will engage more with the national training organization and the national representative. You already gave me up a list of good initiatives. We have also tried for several years to set up a meeting focusing on harmonization of training and education, inviting sister society, stakeholders, and partners, such as accreditation body. Because even if you have a European exam, to practice in a country, you need to follow rules of accreditation bodies that have their own association. We never invited them to talk to us. They're very sensible people, and we assume they are against, but actually we never directly engaged to ask, how can we make this work for all? And how can we make this work for Eastern European, South America, South Africa, Pan-Arabic countries, Mediterranean countries? I think that's a very challenging question, and it's probably one of the main things that is driving me to be a candidate for president. And it's the first pillar of my campaign: equal representation, diversity, and equality. I have a new question, and this is, oh, I don't have the name. Oh, it's from Ina. She's asking, ESIC member cannot communicate with each other. Do you think we should share our email address for professional discussion? There's a bit of a legal question you're asking me, so I don't know what the limitation of these are. I think before sharing emails, we should use a little bit more what we have, which is the European Society network and platform. I don't think people want to have free emails in their box, but probably they want to have possibilities to engage in blogs, discussion, or focus group, not traveling, but through the platform. The third pillar of my campaign is innovation. And innovation is based on new technology. One of the problems we have in the office at the moment is the lack of IT support 24 hours a day. The European Society of Intensive Care is a global society, so needs to work 24 hours a day, unfortunately. We have members from all over the world, and we are not in a position where we can work 8 to 5. So in IT support for me is a crucial point. And I think if I see where I will want to invest, having blog, forum, efficient platform for sharing and connecting, for allowing people to work through the platform is one of my main points. This might link to big data because innovative research needs also networking and link. And I don't think you can do that just by email. I think we can do that using the academia. I have another question from Christian, and he's asking me, what is the input from physician in European Society of Intensive Care membership? Okay, so how can we raise the interest of young physicians in European Society of Intensive Care Medicine? How can we raise the interest? I hope what I'm doing today actually is a way to raise interest. I've noticed that both me and Maurizio, we have been using a lot social media, which is great because this gives you the opportunity to be approachable. Obviously, if I become president, I will keep this as a must. I cannot give the answer. I'm not the only person that works for European Society of Intensive Care Medicine. So what I will do is I encourage people to use social media to be closer and to engage people in the discussion. I think it's been an incredible experience for me, and what I've achieved and I've learned is amazing. It's only a few weeks I came out with what I thought were my priorities, and the direction has changed, has improved, all thanks to you. And I think it's a great opportunity to be here, and I'm sorry, it's my first time dealing with question and answer, so I'm sure I will do it better in future. But it's really crucial to use innovative way to talk to members so that they can get engaged. One very nice question I received regarding innovation is how much will cost and why should we spend this money in education instead of research? That's a challenging question. I'm not saying, and I've never thought we should spend money all in education or take money away from innovative research towards education. I think the point is when you have a new candidate standing for the position, it's really important to raise what the candidate can bring more of what the experience of the candidate is based on. So I think the society is doing great. I think the work in the Congress, the work in research is incredible. And my goal is not to change or to modify that. I think I need to bring what I've learned from working in the Division of Professional Development, and I also need to bring the inputs of members working in education as a step forward. So I'm not here to change what has been achieved, but to push it further, to make it better based on new group of people and new experience that I've developed over the years. I got a question from EDIC examiner. Is asking me, how can you support and award people giving free time and energy to European Society of Intensive Care Medicine in order to make it sustainable? Well, I think the society has done already great things. When I was chair of the division, we awarded the European Diploma of Intensive Care Medicine examiner during the Congress. We offered free entrance to the Congress for those that have been examining 3 times in a row. And now I think we are working to provide continuous medical education European credit based on the number of hours that people spend to provide education for the European Society of Intensive Care Medicine. Of course, this is a minimum thing that we can do, but it's a step. And obviously, probably we will find more way to thank not just the examiner. We have a very, very good group of authors writing courses. And I would like to thank, while I'm here, Frankie Duskos, the chair of CTC, and Christian, who is the chair of the EDIC committee. They have a fantastic team of friends and enthusiasts that are providing their own time to teach and educate. But I think the fantastic thing about their work is the incredible network that I've created. So to be out in a course or to write a course essentially provides a feeling of community and support that is magic, and that probably links the people that are still working for that. Got another question, from Tiffany saying, what do you think about the idea for merged and European Society of Intensive Care Medicine, at least for some important clinical topics? I think this is a question that has been raised several times by chairs in the research group. I think there has been discussion, and the society is already looking at the potential way to do that. Obviously, sharing database has confidentiality issues, and this needs to be addressed, especially in the view of the new confidentiality law. Big data is a reality that must be addressed. I believe that European society will do that for the sections, and potentially discussion can be done with other sister society, because we need to have stronger network to improve care at the bedside. Please, those that have not seen your email, look it up, because we still have another 12 minutes to ask questions, and I'm really, really keen in trying to address as much as I can the topics that you want to ask me. There's not much time before election. This is an event that has been set up with the aim of knowing me, knowing my way of thinking, and raise issues that might be crucial for the future of European Society of Intensive Care Medicine. I think also that it's really important to know candidate in view of transparency and collaborative work. You don't have much opportunity to to meet, and you are 9,000, so it's no way I can meet and talk to all of you. So it's really important for me to prove whether I represent the change and the wish you have to make society working better. A question regarding education. Why would blended learning be better? What is adult learning based on, and how can we enhance learning in adults? So blended learning started when we digitalized education. So as I said at the beginning of the webinar, face-to-face was the unique method to teach before. Nowadays, you can have fantastic speakers recorded, high quality, and stored by topic in the academia platform. We tried a couple of years ago to do this using the refresher course done before the annual Congress. So for those of you that have attended the annual Congress and the refresher conference, you see that the refresher conferences matches the main topic of the Cobatri's curriculum. Every year, we weight different topic, we call international experts, and we spend 2 full days getting top-notch education from all over the world on what we believe is the best knowledge for best intensive care doctors. Since I became the chair of the Division of Professional Development, we asked the society to record every single of these lectures. Over 3 years, we had international top speaker talking about every single point of the Cobatri's curriculum. We are using at the moment those topics in what we call the EDIC-1 preparation course. What does it mean? Going on the platform of the EDIC-1 preparation course, you can, for instance, for respiratory, decide to listen about the talk done on COPD or on pneumonia by Professor Massimo Antonelli. You can, at home, at your time, hear about that and take your own notes. We are not open these learning tools to all the members because it was still an experiment. We believe that we are improving the way that people are using this material. And once we will have enough IT support, and if I become president, it will be my goal to make this knowledge organized by topic available to all members. How can we reach Eastern European countries? How can we reach emerging countries? I think lots of this material could be available very cheap to people living in those areas, to give the opportunity of learning at their own time by top people and top members of the European Society of Intensive Care Medicine. These are only ideas. I could just develop them in initial phase when I was leading education, but I think we have the knowledge, the background, and the possibility to extend and make those real for everyone. Come on, last 10 minutes, please ask me more questions. I think that is really important for me to talk to you about what my views are. Oh yes, so this is a question from Sue, who is a nurse, and she's asking me about how can European Society of Intensive Care Medicine enhance interprofessional works and collaborative works. And that is a perfect question, which gives me the opportunity to answer also to all those nurses who have been treated and been hungry by being not empowered to vote during these elections. I think this is unfair. I think for nurses to be members is hard, is expensive. In my own country, is limited, strongly limited by language barriers, time, resources. I think intensive care is a teamwork. You might know by now, watching my profile, that I like sports and I perform team sports. I cannot see a doctor working on its own. We're not gonna make patient care better up until we don't realize that we need lots of people in the game. We need a goalkeeper, we need an attacker, we need a defender, we need nurses, speech language therapists, pharmacists, nurses, dietitians. We need family, we need patients, we need feedback, we need follow-up clinics. I think European society has addressed some of those points. I remember we did pre-conference courses on ethics and communications and burnout, which were great. But I do not think we have covered and really empowered specialists and healthcare providers to work together as a team. I think it's something I would like to change when I become president. Last 10 minutes, questions. Let me see whether I got something from the web that I'm missing. Yes. Okay, so I have someone asking me what digitalization of education means. That's a good question, actually, because actually this is a broad concept. Digitalization of education means partially blended learning, which I explained already, but might be much more than that. It could be using virtual reality. Let me give you an example. Some of you might have looked at the European diploma of echocardiography. One of the challenges of the diploma is looking at ultrasounds done far away from where the examiner sits. And you need to do a series of exams to assess the quality of the candidates. So in that hub, some of the methods of distant communications and visual report and have been tried and addressed. Once again, this is just the beginning, but I think virtual reality could be a way for running case discussion, word round, exams. Virtual reality could be also a way to improve our European diploma exam. One of the big criticisms we received when we changed the part 2 of the European diploma exam from bedside to OSCE was that we were missing a lot of the professional skills, of the soft skills of the candidate, because obviously we were sitting at a desk, we were not assessing the candidate next to a patient. I think having a virtual reality scenario could supplement this part and even improve our exam. The other thing is artificial intelligence, obviously. I think that will be a challenging way and has been used in several industries. And there's room for talking about that also among the activity of the society. A previous Twitter I received from Kumar was asking me about membership collaboration, how to enhance collaboration among members. Well, I think collaboration is already quite significant among researchers. I think during the annual Congress, there's opportunity to discuss about trial, and also there's opportunity of having meeting on section that develop similar topics. It's not as easy as for research to create a network regarding junior trainee or support of people moving from an area to another area, or supporting emerging country learning about dialysis, ventilation, the use of new technique, the use of antibiotic at the bedside. How can we do that? We need, once again, to use our platform with some more digital support, so that if someone has a specific question, this can be addressed to a section group, and maybe we can have a group of volunteers that are happy to answer the questions on real time. It's not easy. This needs to be tried. We wanted to try some forum, and this worked well to a small group, but we have not been able to extend it to a large group of members yet. I think it's possible, but it will need time, and we'll need members' collaboration, because obviously we cannot build things in a day, but it's nice to raise those points and start small and increase and improve to make it better. Any other questions? I think we covered anyway a lot of my pillars. And if you are not able to send me another question in the last 5 minutes, I would like just probably to use those 5 minutes to summarize in a way what we said. As I mentioned in my introduction, the reason I'm here is related to engagement and communication. I think if I'm presenting myself to be the leader of European Society of Intensive Care Medicine, I want to give the opportunity to members to test whether I realize, whether I embodied your needs, and whether you think I have the capability to realize what I want to realize. I think the society is a great society. I've been working for nearly 2 decades, and I have an incredible network of friends. I'm very proud to be part of it. What I highlight in my program is solely what I can add to such an efficient organization. I face challenges based on my origins and my history to be here today. For me, it was difficult to learn the language, was difficult to move across country, was difficult to be accredited as an intensivist. And nowadays, I am the first woman running for president. I find this a great honor, and regardless the results, for me is a great and enormous success to be here. I've learned so much, and I'm grateful to the people that engaged in the conversation, because this means a lot for me. The pillars of my program are equal representation, and equal representation means help people that might come from emerging countries, that are women, are diverse, and have language barrier, have money barrier, traveling barrier, to be engaged, to be involved, to learn, and to have benefit from the network. Education. Education is important, because European Society of Intensive Care Medicine is achieving great results through science, but we need to bring the science at the bedside to improve patients' outcome. Education is important because this needs to be interdisciplinary. We need to involve every single member working in intensive care and be part of a team. For doing that, you need to train like Formula One runners. And innovation. We cannot maintain and sustain the project with single individual work. We need to involve technology into that. I have the last question before leaving you, and it's again from David, and he's asking me, how can local society implement a European Society of Intensive Care Medicine examination as obligatory, but in a smooth way without forcing doctors? What should be done to show that it is beneficial for them? I don't think forcing is a good way. We have a very good example from our sister society, the European Society of Anesthesia. What they've done, they have created collaboration with every single nation, allowing the nation to translate at least the part one, the written part of the exam. I find it's very difficult to do a very high quality exam. For every single university or national training organization, it is a huge amount of work to provide high quality exam. What the European Society can do is to offer the work done by the committee and collaborate, allowing national society to translate and maybe start with part one as integrated to their training system, and then allow people to decide whether they want to take part two and then fully accredited as EDIC 2. What I've learned by working 8 years in the Union of Medical Specialists is that one does not fit all. You need to engage with people like you, David, with people that guide us at the national level to make sure that we offer good product. Our exam, our platform, our concept are very, very strong. Please tell us how can we support you. And I think this is the only way. It's a two-way discussion. It's not forcing or imposing, because in Europe, this is never gonna work. Up until we don't engage, communicate, and work together, we're not gonna change anything. I tried 8 years, and I think probably this is the only way forward. So for the last 2 minutes, as I said, if you like my program, think about equal representation, think about education, think about innovation. If you believe I can enhance diversity and equality, please vote for me. If you think the approach I have guarantees transparency and fair opportunity, please tweet me back. This is just the beginning. I don't want to take much longer of your time because I think it's precious and I want not to overdo it. But I feel this could be the beginning of the dialogue. On YouTube, I will keep receiving your question and I will reply on a personal basis. And please remember, you still have few days. Voting is gonna close on the 11th of June of midday. Take your chance to make a change, and please continue sending me feedback. If the quality of this question and answer was not at the level you expect, don't worry, send me feedback. I will try to improve it. I will try to get engaged, but I think it's important to be innovative and to be closer to the members on as much as I can. And with that, I thank you very much for your time, and I hope to answer to your questions that will be a lot on the social media. Thank you. Bye-bye.